Everybody is looking for ways to support their child's emotional and mental well-being. Welcome to the Therapy Tips and Tricks channel. Therapy can be a fantastic tool to help children navigate their feelings and experiences. In this video, we'll explore what you and your child can expect in the first therapy session. Going to therapy for the first time can feel like a big adventure for a child. It's like stepping into a brand new world filled with curiosity and maybe a little bit of nervousness. But don't worry, it's completely normal to feel that way. The first therapy session is all about getting to know the therapist and starting to build a trusting relationship. The therapist's main goal is to create a safe and comfortable space where your child feels heard and understood. Think of it like building a sandcastle on the beach. You need a strong foundation before you can add all the cool decorations. This first meeting helps lay that foundation for future sessions. It's a time for the therapist to learn about your child's unique strengths, challenges, and goals. The therapist will use this information to create a personalized plan to help your child thrive. Just like every child is different, every therapy journey is unique too. So buckle up and get ready for an exciting adventure as we explore what you and your child can expect in the first therapy session. Imagine walking into a room and meeting someone new for the first time. That's what it's like for your child when they meet their therapist. Therapists are like friendly guides on this journey of growth and healing. They have special training and skills to help children navigate their feelings and behaviors. During the first meeting, the therapist will introduce themselves in a warm and welcoming way. They might even have a fun nickname that your child can call them. Don't be surprised if they start the session by playing a game or doing an activity together. Therapists know that play is a child's language. It helps them feel comfortable and express themselves more easily. The therapist will also want to hear from your child directly. They might ask questions like, "What do you like to do for fun?" Or, "What's your favorite animal?" These questions might seem simple, but they help the therapist understand what makes your child tick. Remember, the therapist is on your child's side. They are there to listen without judgment and offer support every step of the way. The therapy room isn't your typical doctor's office. Instead of cold, sterile equipment, you'll find shelves overflowing with colorful toys, art supplies, and engaging games. This is because therapists know that play is the key to unlocking a child's inner world. Through play, children can express their feelings, work through challenges, and develop important coping skills. Don't be surprised if your child starts building a tower out of blocks, drawing a picture, or acting out a scene with puppets. Each of these activities provides valuable clues to the therapist about how your child thinks, feels, and interacts with the world. The therapist might join in on the fun too, by building alongside your child, asking open-ended questions, or simply observing their play. It's through these interactions that the therapist starts to build a strong and trusting bond with your child. Play is a powerful tool in therapy, making it an enjoyable and engaging experience for children of all ages. While play is crucial, talking is also an essential part of therapy. The therapist will want to hear about your child's experiences, challenges, and goals. They will listen patiently and attentively as your child shares their thoughts and feelings. Sometimes, children may find it difficult to put their emotions into words. That's perfectly okay. The therapist is trained to pick up on nonverbal cues like body language, facial expressions, and tone of voice. They might use visual aids like feeling charts or drawing prompts to help your child communicate more effectively. The important thing is that your child feels heard and understood, even if they can't always find the right words. Remember, therapy is a safe space for your child to be themselves, express their emotions freely, and work through any challenges they might be facing. The therapist will also want to talk to you, the parents, to gather more information about your child's history, development, and any concerns you might have. This conversation might happen with or without your child present, depending on their age and comfort level. The therapist might ask about your child's strengths, interests, and any challenges they've been facing at home, school, or with peers. They might inquire about your family dynamics, routines, and any significant life events that could be impacting your child's well-being. This is your chance to share your observations, insights, and goals for your child's therapy journey. Remember, you are the experts on your child, and your input is invaluable to the therapist. Working together as a team, you can create a comprehensive plan to support your child's growth and well-being. The therapy room is designed to be a safe, welcoming, and comfortable space for children. It's usually filled with natural light, calming colors, and soft furnishings. You might find cozy beanbag chairs, a soft rug to sit on, or even a small table and chairs for arts and crafts. The atmosphere is meant to be non-threatening and inviting, encouraging children to relax and feel at ease. The therapist will also have a variety of sensory toys and tools on hand, such as fidget spinners, stress balls, or weighted blankets. These items can help children regulate their emotions and feel more grounded, especially if they are feeling anxious or overwhelmed. The goal is to create a space where children feel safe to open up, explore their feelings, and work through any challenges they might be facing. Children often wonder if they have to tell their parents everything they talk about in therapy. It's important to explain to your child that therapy is a safe space where they can talk about anything that's on their mind. However, it's also important to be honest about the limits of confidentiality. Therapists are legally required to report any suspected cases of abuse or neglect, or if a child is in danger of harming themselves or others. You can explain this to your child in an age-appropriate way, emphasizing that their safety and well-being are the top priority. For example, you might say, if you tell the therapist about something that's making you feel unsafe, they might need to tell me so we can work together to keep you safe. Overall, therapy is a confidential space for children to share their thoughts, feelings, and experiences without fear of judgment or repercussions. It's perfectly normal for both children and parents to feel a little nervous before the first therapy session. After all, it's a new experience, and stepping outside of one's comfort zone can be intimidating. Reassure your child that it's okay to feel nervous and that the therapist is there to help them feel comfortable. You can also talk about some of the fun things they might do in therapy, such as playing games, drawing, or talking about their favorite things. Remember to take care of yourself as well. It's natural to feel a range of emotions as you navigate this process with your child. Reach out to your own support system, whether it's your partner, a friend, or a therapist, to process your feelings and get the support you need. The most important thing is to approach this experience with an open mind and a willingness to work together for your child's well-being. Therapy is most effective when everyone is on the same page and working together towards a common goal. This includes the child, the parents, and the therapist. Think of it like a three-legged stool. Each leg is essential for stability and balance. During the first session, the therapist will likely discuss their approach to therapy and how they involve parents in the process. They might encourage you to share your observations, concerns, and goals for your child's treatment. The therapist might also suggest some strategies you can implement at home to support your child's progress. This could include things like creating a calming bedtime routine, practicing mindfulness exercises together, or setting aside regular time for family fun. Remember, you are not alone in this journey. By working collaboratively with the therapist, you can create a supportive and nurturing environment where your child can thrive. The first therapy session is just the beginning of a journey towards healing and growth. It's a time to establish a connection, gather information, and set the stage for future sessions. After the initial meeting, the therapist will likely recommend a schedule for ongoing sessions. The frequency and duration of therapy can vary depending on your child's needs and the therapist's recommendations. You can expect the therapist to continue to use a combination of play, talk therapy, and other creative techniques to help your child explore their feelings, develop coping skills, and work through any challenges they might be facing. It's important to remember that therapy is not a quick fix. It's an ongoing process that requires patience, commitment, and a willingness to embrace both progress and setbacks along the way. Seeking therapy for your child is a sign of strength and a commitment to their well-being. Therapy can provide children with a safe and supportive space to express their feelings. Therapy offers children a non-judgmental environment to explore and express their emotions, even the difficult ones. Therapists can teach children healthy coping mechanisms for managing stress, anxiety, anger, and other challenging emotions. Therapy can help children enhance their communication skills, learning how to express their needs and boundaries effectively. Through therapy, children can gain a better understanding of themselves, build self-compassion, and develop a more positive self-image. Therapy can provide tools and insights to improve relationships with family members, friends, and peers. By investing in your child's mental health through therapy, you are giving them the gift of a brighter future filled with resilience, self-awareness, and emotional well-being. If you found this video helpful, please like, subscribe, and share it with others who might benefit. Your support helps us create more valuable content for you and your loved ones.